The title of this session is Success and Challenges of Women in Male-Dominated Environments. I couldn't help but reflect a little on this title. I work in three often male-dominated environments: clinical medicine, where I'm a practicing family physician and hospitalist, as well as academic medicine and medical education, as well as international partnerships. In U.S. medicine, our institutions have, since their inception, been male-dominated. Even now, only 28% of faculty positions in our training institutions belong to women. Recently, women surpassed men in medical school acceptances here in the U.S. Women's stamp on medical education is only recently gaining momentum. This could be considered the feminization of medical education. This demonstrates how empowerment is not just an abstract concept, but actually when women are growing numbers in our institutions, they change those institutions because of the inherent qualities that they possess. Research indicates that female doctors have stronger communication skills, greater partnership with patients, and spend more time with patients than their male counterparts. This reflects the unique traits that female physicians possess. Medical school curriculums are only recently prioritizing these themes, and they are mostly doing so in optional and peripheral ways. So classes such as professionalization, empathy, compassionate communications are starting to arise in our medical schools, but they're still maybe a week long, maybe an hour here or there. They're not integrated into our curriculums. In the meantime, basic science is given almost an entire year of the medical education, and many would argue that it does not lead to greater physician or patient satisfaction or performance. I was often reminded of the male-dominated history and leadership of medicine when I would give tours at my medical school. Part of the tour was ambling down a long hallway that had picture frames on both sides of leaders, deans, and award recipients. I'm not going to say what I called this hall, but I will say that it was filled with male faces, and they were all of pretty much one race, really. There was a few females intermixed in there, but significantly it was male-dominated. This is a constant reminder that when it's difficult to identify, difficult to identify with those that are in leadership and are celebrated with awards, recognition, photographs, and hallways. It is often difficult to aspire to those positions because you yourself do not identify with the people that hold them. It also made me question my definition of success. I see my concept of success, personally, to be quite different from many of the men lining those hallways and many of the men that are currently in leadership positions at my hospital and at the teaching institutions where I work. My professional aspirations were significantly impacted by becoming a mother. I find that the insatiable urge to climb professional ladders, to get to some top, that there never seemed to be a top, ongoing, was tempered when I had my daughter. I think this insatiable urge was supplanted by a desire to achieve balance, a sense of accomplishment both as a single mother, a caregiver, a doctor, a teacher, and a global health leader. One mentor at my residency, a female physician herself and mother of three, told me that you don't get awards for balance, and it requires mediocrity in one arena or the other. She felt that her mediocrity was in her professional career as a medical educator. But ultimately, she felt that balance was the greatest success you can achieve.